So today we're going to talk about the health space, but I just wanted to share a little bit about what's happening in the health sector generally as a result of COVID-19 pandemic, so that you all know that there's a whole lot of work going on behind the scenes at a systemic level, and the stuff that you feed into us, the issues you have, the concerns you raise do get fed back up the line, so to speak, within the state government area, but also in the Commonwealth government area, through our allies, through the peak bodies, and through our direct connections with the departments of health at state and federal levels. So the latest meeting that I've had has shared that the Commonwealth, at the Commonwealth level, that operation and management plan they came up with when COVID first started, when it first began, there was a whole lot of lobbying, which resulted in this particular plan coming into place, and it was specifically aimed to support people with a disability, also the support workers, but the disability workforce, the health professionals involved with that, and then families as well. So the first phase was about preparedness. The second phase, which we're now entering, phase 2, is more for targeted action. And so it's looking at ways to optimise the health and disability support responses. It's looking at how to help recovery and minimise the future infection spreading. It's looking at how to make sure that PPE is currently, what we need, the demand that is required is actually going to be supplied. And so that's kind of the phase we're in at the moment. We are providing a link at the end in our helpful link, tile. So everything in that space will include the Commonwealth Government's website, and included in that is also advice for people with a disability, any support that people with a disability might need, information for families, information for support workers and health professionals. And so one particular link that's within that space is there is a coronavirus hospital companion for people with a disability, which you might want to have a look at, and it just talks about information that you can share and be prepared in case something does come up where your person with a disability or you yourself need to enter the hospital system, so that you've got your information ready, because usually it's a time of panic or everything's happening very quickly and you don't have that time to prepare those kinds of things. So it's good to be prepared, and that way you know that you're ready, and that can also help you have a sense of calmness when you are going into the hospital system. You know what you need to do, and you're ready to go. There is a particular video that was mentioned on PPE and how it can be useful for children that are with a disability that are returning to school. So you might want to have a look at that if that's relevant to you. They also talked about some resources that were available for Aboriginal and Torres Strait Islander people in easy read form. So Clara, if you can move to the next slide. In the New South Wales health sector, they formed what they call the Disability Community of Practice right at the beginning, and there are 30 different communities of practice. This one is specifically for disability, made up of a very diverse group of advocates, commissioners and consumers. So there was a clinical excellence centre tuning in, clinical leaders within the Department of Health, and the idea was to give some real-time responsiveness. And I have to say, from my experience, whatever was being fed into me from families, and I was feeding it directly to them, they were acting on it quickly, giving us the right context so that we could do something about it, or formulating working groups to work on specific things that hadn't yet been created. So for example, we had some issues with PPE, personal protective equipment. And so they made sure that first of all, the information on that was in an easy to read form, and that there were videos available explaining how to use it. They also gave us links and in terms of how to make sure, if it was in the school system, how you could get it. If you're in the health system, how you could receive it or order it or get access to it. So one of the areas that was also an issue to some families in all of us is what happens if your person with a disability does have to enter the hospital system during COVID times. There isn't a specific policy document on this, and so they realised that they wanted to put something together, and so that's just something, a spin-off that has just been created, a working group, so that they can come up with something for families, say from admission to discharge, so that you know what your rights are, what you've got something in an easy read form, say like a one-page document that you can hand to the hospital, because of course every single hospital will have its own policies. But this can be a really great piece of guidance for you to say, this is from the New South Wales Health Department, you know, and these are my rights to be here, just to make sure that you can be a presence in your person's life if they have to enter hospital. Another area that that has come as a spin-off of this is a communications working group, because it became very apparent that there was so much going on, it was happening so quickly. But it wasn't in an accessible form. It wasn't in an easy to read form. And so that is a working group that is going to continue to make sure that that becomes an automatic process when there are new announcements coming through, so that people with a disability and their families can be properly updated about what the changes are within the hospital and medical system. Another area that has just come into play is there's a thing called a response plan for infection control. And so they've given us an example and explained how it worked in a group home, for example. But it does apply to anybody, whether they're living at home or whether they're living independently or in a group home. If a person with a disability tests positive for COVID-19, or one of their support workers or health workers, staff member tests positive, there is a very tailored response that they've got within a 3-hour period. You'll be contacted, and they will come up. They've got specialists on hand to come up with a plan, and it is specifically for people with an intellectual disability or a developmental disability, so that they can properly assess what the risks are in the living environment, any comorbidities that might need to be taken into account, and whether it's staff or the person with the disability, and then once that plan comes into place, that gets followed up every day for 7 days by the department. And you know, any adjustments that might need to be made, any suggestions if things are not working well. But so far their response has been excellent. They've had 100% success. There hasn't been any spread with the plans that they've had so far. And so they want to keep going on with this particular response plan, and spread it out through, I shouldn't use the word spread, you apply it through the rest of the state to make sure that we keep on top of things. So thanks, Clara. If you can move on to the next slide. So I just wanted to let you all know there's a specialist intellectual disability health centres that have been set up throughout the state, and that's done through lots of lobbying over the many years, highlighting the fact that people with an intellectual disability just weren't being looked after properly. People didn't have the right skill set to properly take care of them and administer any health needs that they might have. So, and they've set up with a hub and spoke model. So it's centralised, but it has 6 locations. And so throughout Sydney, there's 4 different centres: Metro, South East, South West and Central and North Sydney. And then there's Western New South Wales. And then there's the Hunter New England area. And so they've been set up with multidisciplinary approach. So they've got rehab specialists and psychologists, GP, etc. And they are all now officially up and running. So just so you know, my understanding is that you know, not all doctors are going to know about this. Not all GPs will know about it. So it's really up to you to request it, to bring it to their attention, and let them know that it's there and that you want to tap into that if that's relevant for you. Thanks, Clara. And then just finally in the NDIS space, there were lots of changes that were made to try to cater and allow for this COVID period to make sure that things could run as smoothly as possible. One thing that I recently found out was that the NDIS provided a list of people with disability to the local health districts. And it's only during this COVID time, but it's so that they could target people that may be at risk, that might fall through the cracks, to be able to make sure that everybody was being looked after, and to make sure that people would still having their normal, regular health checks, to help them set up with telehealth if that was required. So as a result of that, the NDIS allowed assistive technology to be purchased without quotes or approval up to the value of $750. And that was for the purposes to allow access to telehealth appointments. I understand that this will end as of the 1st of July. So you have a couple more days, if you've missed that one, to purchase some assistive technology like an iPad or something like that. So the other thing that came through was that there would be an automatic renewal of plans, so that, you know, there wasn't this kind of stop-start approach, that allied health professionals could continue on without disruption during this COVID period, and they would be accessible to people with a disability. The other thing that the Department of Health ran was a media campaign to encourage people to see their GPs and to keep up with their regular health care. And so that was another thing, that the one thing that I did miss from the first slide was that they did specifically mention last week that dental health was obviously something that fell away, and that is now a top priority in their books. That's something that they've opened up again, and they're going to be targeting to make sure that people catch up on any appointments missed and things like that. And so that's it from me for just an update on the health sector. I hope you found it useful. If there's any questions that you would like to follow up with me afterwards, please let me know in the chat and we can take that offline afterwards. And so I'll take it away. I'll send the rest of you over to Karen in her capable hands to share with you her advocacy tips on medical safeguarding. Thanks, Karen.
Okay, thanks, Leanne. Okay, hi all. Firstly, I just wanted to kick off by actually having a quick slide here saying, why do we actually need to have a webinar on medical safeguarding? Why do we need to consider our advocacy in our health and medical systems? So just briefly, you'd, I think, all be aware by now that there is a Disability Royal Commission on at the moment that will be on for another couple of years. It actually recently, well, February, just before the lockdown, held a 2-week public hearing here in Sydney on health. And they heard evidence over those 2 weeks from a load of people. Some of you may have tuned in and had a listen or even attended, from many people with disability, from their families and allies, that show that people with disability can be really extremely vulnerable in our health system. With the Disability Royal Commission, it's continuing on. We have Troy in our office. Please do make contact and consider putting in submissions yourself so that your experiences are on record as well. So, you know, there is increased vulnerability for people with disability due to their communication needs or complexity of their health and physicality, and also indeed their capacity, especially for intellectual cognition disabilities, their capacity of understanding what's happening around them and being able to communicate in these really critical health times, and particularly in the hospital system. Also, in terms of devaluation in society, it's hard to hear, but societies not generally value disability, which can mean healthcare is not always provided or maybe not prioritised for people with disability. And unfortunately, there's many examples of poor medical care for people with disabilities. I'm sure you've seen it through media, as well as I've mentioned a lot of things being said in that Disability Royal Commission on Health. Also, we have imperfect systems. Human services aren't perfect in any way, and certainly humans aren't perfect either. And it means if we have an over-reliance on the belief that the system will provide for people with disabilities, then that's not helpful and can be damaging and dangerous as well. We can't have that reliability or reliance on the system protecting people with disabilities. Many people, as you're probably well aware, there's a reflection in our society that too often segregates people with disability away from the rest of society. So a lot of people aren't exposed to understanding and knowing people with disabilities in their world, and may not have an understanding of how to adjust or to modify or to consider their needs as an individual, and therefore not be able to provide potentially the proper care, let alone be able to listen to them well and communicate with the person's needs in an effective and a relevant way. And finally, just a point there, in the University of New South Wales, there was a study done a few years back that found that Australians with intellectual disability are dying from avoidable deaths at twice the rate of the general population. Okay, and that's on avoidable deaths. Julian Troller, who I think Leanne mentioned earlier, is a head of a particular disability mental health at UNSW, has said that in that report that people were dying from potentially avoidable causes because they experienced multiple barriers to quality health care and because health professionals and services were not equipped to meet their needs. So that's just a recap of why this is so critical and why this is important, and I'm glad that we were able to provide this some of this information to you today. So we want to move on now to, so what can we do about that? And there are things that we can do about that to safeguard that and to stop that being an issue or barrier for your person and people in your lives. Firstly, documenting a personal plan. So writing down a plan means that you can hand out information to people and increase others' understanding of the person that's presenting to them. We would say use it always and use it often, as it wouldn't be an official document for the nurses and the staff to have to look at in terms of their needs. So we want people to read it and understand it offers nuanced and extra information that will really help in the care of the person and the outcomes that can be realised from their health care. It's also important not to presume that information has been shared and referred to between various people that will be involved, the GP, the allied health team, the nursing staff, the specialists. The fluidity of information, particularly in critical times or time-issued times, is not necessarily as good communication as you might wish or expect from our medical system. So having that document and that personal plan is really important. There's a lot of information and time to read through it for all those different nursing and medical staff is not always allocated for them. They want to be able to read all the information. So if we can share something that's very helpful, then that's really important, and we can verbalise it as well. Having everything in one place is absolute time saver and an important reference point for people, particularly if some decisions are needing to get made and you or other allies and supporters of the person are not on hand, that there's something there that can help when a decision is needed. Of course, having the understanding of their communication needs, of devices they may use, translation requirements that are needed is important, and the consideration of using things like visual tools to help to explain things to the person themselves is important. Information on how the person responds and reacts to the world around them, their capacity to understand questions and be able to answer them well, or be able to be supported to answer them, and not have someone be asking them questions where they might just say yes without any understanding of what's being asked of them. So this is important to all have in that personal plan. And an understanding of something, for instance, like how do they show pain? Because sometimes people are not showing pain in a typical way, and therefore not getting some treatment and pain medications that they might need because it's not shown in a typical way that they're used to from other patients. Also, evidence of the need for family members and supporters being present. At the current time with COVID-19 and people not being able to be with the person all the time, there can be exceptions to being able to be there, but you will need to show evidence that your presence is really vital for the ongoing care and the outcomes that can be received by the person. So if you are told not to be at their side because of COVID, then I would suggest you push back on that and talk about the evidence and why you would need to be there, and see where you can go with that information to make sure that your person is safeguarded well.
Sorry, Karen, I'm just letting you know it's 2 minutes before 12.
Oh, okay. I won't show the personal plan. I have got a link there and I'm going to show you it in the helpful hints, but there is a really good example plan that I'll share with you from the University of Florida, and we'll have other things that we can share with you as well in that. In terms of the vision of whole of life, please don't underestimate that in these times as well. That sharing that with others and having that vision be shown, they're seeing your person or the person in just one space and time. We're looking at a whole of life approach to someone, and that's really important to share and is very valuable. Include others as well who are our allies and supporters on that document. Understanding the system you're dealing with. How does the hospital tick? Who is the line of command? When do the shifts change? When do regular tasks occur? Asking lots of questions to get a sense of that reality there. Know the decision makers as well, as we say, in all settings. So you don't want to waste time talking at length to a person that actually hasn't got the capacity or the decision making to take that further or to make a change happen. So you want to know who it is that you need to talk to at that point in time. But building the relationship with the team around the person is really important, particularly the direct nursing staff. The vision we mentioned can show maybe that there are even commonalities between your person or yourselves and the nursing staff, and that can add to the building of a relationship there. Sharing the document plan, the vision, helping them to get to know your person well, because we want them on site and advocating for our person as well, and helping them to meet their needs. And remembering it is really a two-way street. So what do they need from us? And what processes do they want you to follow? Particularly, there might be different processes because of the pandemic at the moment. So be respectful, know what that is, and be doing what we can to support that as well. Okay, so some other advocacy tips. Believing in yourself, remembering that we have a natural authority as family and supporters of someone. So the buck stops with you, if you like, in terms of that family members getting their support. So when it is tough, do you stop, or do you keep going to ensure that you're getting heard and that their needs are getting met? You don't want to hand it over to the medical authority for the reasons that I outlined in the first slide that I talked about. You know them best, and it can be overwhelming to come to grips with the information that might be presented to you. So also make sure that you do your own research. Google, talk to others, make phone calls, read up on information, and really try and be across a lot of that information that's happening, because it can be coming in very speedily as well. And also, if you find that there's experts in this area, be brave and call them and get some information and ask questions about that direct to someone else as well. Being there and observing is critical. Writing notes in a notebook, having the personal plan there that we've talked about, knowing what the roles of the people who are providing care and support are and what is their responsibility, noting that down in a notebook, who's on shift, can be good for referring back for anything that's questions you might have later. We're trying to improve outcomes and cut through red tape or miscommunication or lack of sharing that can go on. Looking for things that are going wrong. Maybe there's lines that are twisted. Being observing and being present is really important. The errors can be made and the person might not be able to speak up on that. So we're being vigilant and observing and being a presence and making sure we're clearly talking about that and making sure those things are getting fixed and adjusted. It is a two-pronged approach with the person first. Firstly, we want to ensure the care is provided. It's the same as what you would expect for care for any other person presenting with this condition. Too often people with disability might not be offered the same level of care. A 17-year-old girl with an intellectual disability was told there's no point getting her grommets to improve her hearing because of her intellectual disability. A 9-year-old boy being told he doesn't need glasses, when in fact he was considered legally blind when he went and had a second opinion by a different practitioner. So this is really important. Secondly, we want to show that the person is a person. They've got a life, okay? They've got a life around outside of this hospital, clearly, with people who love them and show them and know them and that they have strengths. How do we do this? We take a framed photo of our family and friends with him and her. We have any awards that they may have got, and games that they like to play, cards from people around the room as well. It all goes really a long way to indicating that this person matters and demands their attention, respect and care. Remember that nurses are not always sure how to understand someone with disability, especially maybe, and I mentioned before, how to report pain. So having that kind of information on hand for them is critical. A guest book is another helpful tip. Great way of showing the person has people in their lives, document phone calls that have come in, Zoom calls they've had, visits that they've had with people. It can also show that, it can also give some indications of what to do, how to sit with this person. Maybe there's a TV show they love and you've been watching it. You could make note of that. You could be reading a book together and say, oh, it's in the second drawer up to chapter 7. We love this book, so we can read it together. Certain music they might like to do. We like to do something like Sudoku. Please, add another square to our Sudoku that we're doing together. These can be great ways of helping visitors to really engage well and spend time. And that's really helpful for everyone. And it's really limitless and around the person, helps bring lots of joy. Questioning, can't say it enough, questioning is critical. Don't hand it over to medical authority. Ask your own questions, look for discrepancies of information that might occur between people, request information that doesn't have jargon in it when you need to. It might become important to get a second opinion. They certainly made the difference to that young 9-year-old boy I mentioned with his vision. It might also be that you're finding someone that has a better fit match of personality so that they work better with your person. You may understand that a person is feeling pain and can request pre-medication before treatments to reduce that pain or reduce that anxiety that might have long-term effects to their care. Sometimes medical staff will focus on the condition and the symptom and miss actually important health conditions that the person is having as well, that aren't necessarily about the intellectual disability or condition that they have. So some healthcare and GPs will actually say, let's apply a wait and see approach and see how things go. But sometimes that is not what's needed. And you need to be there to say, no, we need to be working on this because this is not about him having Down syndrome or autism or any other particular condition. This is about his health or her health. Okay, we are humans and love being appreciated. So I just wanted to put a note there about showing appreciation to people and staff that are doing good things, that are taking in the care of your person. Maybe sending providing some flowers or chocolates at the nursing station with a note on it that clearly indicates that that's around your person's care. And that can be a really good way of building that relationship we want as well. What happens if things start to go wrong? So just quickly, conflicts can be hard, but we have to be a bit prepared for this. So you can request a case conference with the team. You can actually ask for this team to come back together if that's really problematic and needs to be talked about. You could talk to other allies that you've built up in the hospital. Be ready to speak, even though you might be hearing, poor attitudes towards your person. Be ready to go beyond that and get on with the conversation that needs to be done. You need to remain, you want to be there. You don't want to be sent away for any kind of aggressive behaviour or negative behaviours either. So we want to be able to try and maintain our presence at that point. So sometimes we need to rant external from the hospital to our friends and family if necessary. But when we're in the hospital, we want to remain as clear and on the side of our person as possible. But take a break. Maybe you need to take a break and get some other family members or friends to come in and assist you so you can have a rest. Really helpful to have a great relationship with the GP, someone that's got the person at the heart, has a history and understanding of the person way beyond any specialist would be able to have. So that's, I know, a lot in a nutshell. We have got some helpful links here, and we will include some of our Commonwealth Health Department's links to information, as well as the ones that I said are helpful from the USA that I will pass through in those links. We are here to have conversations with as you need to, and we will be sending you a lot of information out soon. But at this point, if anyone is able to stay on and would like to ask some questions, please go ahead.